I always covered my legs.
I was certainly self-conscious, being out in public with shorts at a public event where I'm walking around with friends.
If you experience discomfort, swelling, and varicose veins in your legs or ankles, you may be suffering from superficial venous reflux disease. Approximately 25 million people in the United States suffer from this condition. Varicose veins are caused by damaged valves, which result in backward flow of blood in your legs, a condition known as venous reflux. This can cause blood to pool in your legs and lead to symptoms such as pain, swelling, and varicose veins.
What it's like having varicose veins at the young age that I had them is like being an old lady before your time. You get tired easily, you have a lot of pain, your range of motion is somewhat limited. My legs were swollen.
The symptoms I experienced were pain in my right thigh, some muscle cramping, and bulging veins in my shin and calf. It was really bad.
Superficial venous reflux disease can be progressive. Symptoms may worsen over time if left untreated. By seeking treatment, you have taken the first step toward recovery from these painful and unsightly problems. Traditional vein stripping surgery has been the only option available to treat venous reflux, an underlying cause of varicose veins. Vein stripping includes incisions at the groin and calf. A stripper tool is threaded through the diseased vein, and the vein is then pulled out of the leg. This can result in pain and bruising for the patient during the 2 to 4 week convalescence. Now patients can be treated with the closure procedure, a minimally invasive alternative to vein stripping surgery. Closure utilizes radio frequency energy to heat and seal the veins shut. In one report, 98% of patients surveyed who have undergone the closure procedure are willing to recommend it to a friend or family member. Recovery time is very short. Most patients return to normal activities typically within a day. If your physician feels that you are a candidate for the closure procedure, here is what the preparation for the procedure will be. Using ultrasound to scan your leg, your physician will determine where superficial venous reflux is present and map your vein. The closure procedure is performed on an outpatient basis. Using ultrasound, your physician will position the closure catheter into the diseased vein through a small opening in the skin. The catheter delivers radio frequency, or RF energy, to the vein wall. As the RF energy is provided and the catheter is withdrawn, the vein wall is heated, causing the collagen in the vein wall to shrink and the vein to close. The closed vein is left in place and over time is reabsorbed by the body. Once the diseased vein is closed, the blood is rerouted to normal, healthy veins.
My experience with the closure procedure was exactly like my physicians told me it would be, every step of the way.
The closure procedure was very comfortable for me.
There was no pain, no throbbing, no numbness, none of the things that they said might happen. Nothing. I felt perfectly fine. I mean, I was ready to get out of bed and walk out of there.
Following the procedure, a simple bandage is placed over the insertion site. To aid healing, your doctor may also wrap your leg or provide compression stockings for a short period of time. Your doctor may encourage you to walk, avoid long periods of sitting or standing, and refrain from strenuous activities for a while. The closure procedure allows you to get back to normal routine activities, typically within a day, with minimal to no swelling, bruising, or scarring.
The fact is, I could walk around. That was the amazing thing to me. 2 hours after my procedure was performed, I walked up 2 flights of stairs under my own power, walked around, got myself something to drink, watched a couple movies.
The day after the closure procedure, I was up and hiking on the mountain. Now, I had some discomfort from leaping right into a difficult, steep mountain hike, but not enough to complain about. And so I'd really have to say that I was able to resume normal activities within 24 hours of the procedure.
In a comparative trial, results were in favor of the closure procedure as compared to vein stripping surgery. Key findings indicate that patients who underwent the closure procedure experienced significantly less post-operative pain and bruising and returned to work more than a week earlier than vein stripping patients. The closure procedure has proven to be highly effective, with more than 90% of veins treated remaining reflux-free 2 years after treatment. Patients report rapid and pronounced relief of venous reflux symptoms in legs treated with the closure system.
I feel fantastic. There really isn't anything that I can't do.
The cosmetic effects were 100% improved. The bulging in my legs that I'd seen that was thick as my finger, gone. Haven't seen it since.
I have to admit that I get compliments on the way that my legs look now. That's something I never thought would happen.
Physicians may recommend other treatments, including phlebectomy, sclerotherapy, or surface laser treatments to address visible spider and varicose veins. Phlebectomy is often used to treat medium to large-size varicose veins. Using specialized instruments that resemble crochet hooks, your physician will make a series of tiny incisions and remove noticeable diseased veins. To treat tiny purple or red veins, often referred to as spider veins, your physician may perform sclerotherapy. Using a series of injections, your physician will deliver a chemical solution within the vein. The solution damages the inside of the vein wall, causing them to close. Multiple treatments of sclerotherapy are usually needed to achieve good cosmetic results. Following phlebectomy and sclerotherapy, your physician may advise you to wear compression stockings. The closure procedure has been successful for treating appropriate patients with superficial venous reflux. Follow up with your physician to determine the best treatment for your condition.